That burning sensation in your chest after a good meal isn't just uncomfortable. It is stomach acid slowly damaging your esophagus, and ignoring it could lead to much bigger health issues down the road. Hello, everyone. I am Dr. Matthew Harrison. In my years of clinical practice, acid reflux is easily one of the most common complaints I hear from patients. It turns enjoyable dinners and peaceful nights of sleep into a painful struggle. If you are tired of relying on over-the-counter medications that only mask the symptoms, you are in the right place. Today, we are looking at the science behind acid reflux home remedies that actually work. Before we dive into the physiology of how to manage this naturally, please take a moment to subscribe to our channel and turn on notifications. Our goal here is to provide you with honest, medically backed guidance so you can make informed decisions about your daily health. Thank you for being a part of this community. Let us know in the comments if you have been struggling with this lately, as sharing your experience helps us build a highly supportive space. To fix a problem, we first have to understand why it is happening. At the bottom of your esophagus, the tube that connects your mouth to your stomach, there is a ring of muscle called the lower esophageal sphincter, or the LES. Think of the LES as a one-way gateway. It is supposed to open when you swallow food, and then immediately clamp shut to keep highly acidic gastric juices inside your stomach. However, when the LES relaxes at the wrong time or becomes physically weakened, that harsh stomach acid escapes upward. The lining of your stomach is built to withstand acid, but your esophagus is not. That is why you feel that intense burn, sour regurgitation, or even a chronic dry cough. Our goal with acid reflux home remedies is not to stop your stomach from producing acid entirely, because you need acid to digest food and absorb nutrients, but rather to help that gateway do its job and protect your esophageal lining. Let us start with the simplest, completely free physical adjustment you can make tonight: gravity. Many people experience their worst reflux symptoms at night because when you lie flat, gravity no longer keeps the acid down in your stomach. It easily slips past the relaxed LES and travels up your throat. The first remedy is elevating the head of your bed. Now, I do not mean just piling up extra pillows under your head. That actually bends your neck and torso, increasing pressure on your abdomen and forcing more acid upward. Instead, you want to elevate the actual frame of your bed. You can use bed risers under the top posts, or use a wedge pillow to elevate your entire upper body from the waist up. Aim for an incline of about 6 to 9 inches. Secondly, clinical studies show that sleeping on your left side significantly reduces reflux. Anatomically, your stomach is positioned on the left side of your body. When you sleep on your left side, the junction between your stomach and esophagus sits above the level of the gastric acid pool. If you sleep on your right side, that junction is submerged, making it much easier for acid to leak out. Try making this simple sleep posture switch tonight and see how much better you feel. Next, let us discuss diet and eating habits, which are the cornerstone of long-term relief. One of the most common mistakes people make is eating a large meal right before going to bed. When you eat, your stomach stretches and produces a significant amount of acid to digest the food. If you lie down within 3 hours of eating, you are practically inviting that acid to travel upward. Make it a strict rule to finish your last meal of the day at least 3 hours before your head hits the pillow. Additionally, we need to talk about trigger foods. You have probably heard of the usual culprits: citrus fruits, tomatoes, raw onions, garlic, chocolate, and caffeine. But what actually happens on a physiological level when you consume these? Certain foods, like peppermint and chocolate, contain compounds that physically relax the LES muscle, causing the gateway to stay open. High-fat foods delay stomach emptying, meaning food sits in your stomach longer, creating prolonged pressure. I always recommend keeping a simple food journal for a week. Note down what you eat and when the burn starts. This will help you identify your personal triggers so you can avoid them without having to unnecessarily restrict your entire diet. Now, let us tackle one of the most debated natural remedies online: apple cider vinegar. It sounds completely counterintuitive to drink an acid to treat acid reflux, but there is a fascinating clinical reason why this works for some people. In many cases, reflux is actually caused by having too little stomach acid, a condition known as hypochlorhydria, rather than too much. When your stomach acid is too low, food cannot be digested properly. It ferments, creates gas, increases pressure in the stomach, and forces the LES open. Furthermore, a highly acidic environment is the chemical signal that tells the LES to close tightly. If the stomach isn't acidic enough, the gateway stays loose. Drinking 1 tablespoon of raw, unfiltered apple cider vinegar, diluted in a warm glass of water, about 15 to 20 minutes before a meal, can help optimize your stomach's pH, signaling the LES to close. However, a word of caution: if you have an active stomach ulcer or severe esophageal inflammation, apple cider vinegar can make the pain worse. Always listen to your body. For those moments when you need quick, immediate relief, there is baking soda or sodium bicarbonate. Baking soda is highly alkaline, meaning it acts as a natural antacid. Mixing half a teaspoon of baking soda into 4 ounces of water can rapidly neutralize stomach acid and extinguish the burn within minutes. But remember, this is an emergency rescue remedy, not a daily cure. Baking soda is very high in sodium, which can be a concern if you have high blood pressure or heart issues. Overusing it can also trigger a phenomenon called acid rebound, where your stomach produces even more acid to compensate for the sudden drop. If you are finding these medical explanations helpful, please hit the like button and share this video with a friend or family member who might be struggling. Your support helps us reach more people who are looking for safe, natural ways to improve their health without relying solely on medications. For a safer, daily protective approach, we look to demulcents, which are natural substances that coat and soothe irritated tissues. My top recommendation here is pure aloe vera juice. Just make sure it is the inner leaf gel variety, as the outer leaf contains a natural laxative. Aloe vera is packed with anti-inflammatory compounds that help heal the delicate mucosal lining of your esophagus, much like how it soothes a sunburn on your skin. Drinking a quarter cup of aloe vera juice about 20 minutes before your meals can create a soothing, protective barrier. Other incredible demulcent herbs include slippery elm bark and marshmallow root. When mixed with water, these herbs create a gel-like substance called mucilage. This mucilage coats the throat and stomach, acting as a physical shield against gastric acid, allowing your tissues to heal naturally over time. Another highly effective and surprisingly simple remedy is chewing sugar-free gum after a meal. When you chew gum, you stimulate the salivary glands to produce more saliva. Saliva is naturally alkaline because it contains bicarbonate ions. As you swallow this extra saliva, it neutralizes the acid in your esophagus. Furthermore, the physical act of swallowing stimulates peristalsis, which are the rhythmic muscle contractions that sweep any escaped acid back down into the stomach where it belongs. Just make sure to avoid peppermint-flavored gum, as peppermint can relax the LES and worsen the problem. Stick to ginger or fruit-flavored options instead. We must also look at an often overlooked remedy: diaphragmatic breathing. Your esophagus passes through your diaphragm, which is the large muscle separating your chest cavity from your abdomen. The portion of the diaphragm that surrounds the esophagus actually acts as an external sphincter, physically supporting the LES. Clinical studies have shown that practicing deep diaphragmatic breathing exercises for 10 to 15 minutes daily can strengthen this muscular barrier. To do this, sit or lie down comfortably. Place one hand on your chest and the other on your abdomen. Inhale slowly through your nose, ensuring the hand on your abdomen rises while the hand on your chest remains still. exhale slowly through your mouth. This simple practice physically reinforces the gateway and reduces the frequency of reflux episodes. Finally, let us talk about physical pressure. Anything that puts extra pressure on your abdomen can physically push stomach acid upward. This includes wearing tight belts, tight-waisted pants, or carrying excess weight around your midsection. Reducing intra-abdominal pressure by wearing comfortable, loose clothing and working toward a healthy weight can drastically reduce the mechanical force pushing acid past the LES. While these home remedies are incredibly effective for the vast majority of people, as a physician, I must emphasize that there are certain warning signs you should never ignore. If you experience difficulty swallowing, unexplained weight loss, persistent vomiting, or if your stools appear dark and tarry, please consult a healthcare professional immediately. These can be symptoms of more serious underlying issues that require a formal medical evaluation. Managing your digestive health is a journey that requires patience, consistency, and a mindful approach to how you treat your body. Thank you for trusting me with your health and wellness journey today. Be kind to your body, feed it well, and I will see you in our next video.